Hello, I'm Mary Burke, the CEO of Myo Munchee. The Myo Munchee is a chewing tool used by babies, children and adults to help strengthen the muscles of the lips, face and jaw. But this isn't just about the mouth. Chewing is an essential movement that is a critical input that connects to breathing, sleep, speech, posture, attention and even emotional regulation. Although the Myo Munchee is an incredibly simple tool to work with, its benefits are far-reaching and it is having transformative impacts on the way we think about health, development and how we raise our children. I had the privilege of interviewing a group of amazing clinicians who have many years of experience and incredible insights when I was at the American Academy of Physiologic Medicine and Dentistry event, Collaboration Cures. So enjoy these incredible insights that they're sharing with us. At Myo Munchee, we're passionate about reconnecting with the simple action of chewing to activate healthy biological development, growth, rest and resilience. When we miss this essential movement, the consequences can ripple across the lifespan and affect both brain and body development.
We are hardwired to chew hard, but it has to be developed in early childhood, in utero actually, and Dr. Katwa brought that up, that these kids are chewing and sucking amniotic fluid.
Well, in the perfect world, we would work on the body and get the cranium and the whole body in a good balanced position so that then the mandible can seat appropriately and then the teeth are in a good position. And so function like that's super duper important. And of course, you know, the tongue is a huge stabilizer, not just for the jaw and the mandible, but for the whole, really the whole body, even your knees stronger with your tongue up.
Our mission is to optimize the genetic potential of the next generation. And that means supporting healthy development in the earliest years, using natural inputs to help children grow the way nature intended. Because when we're chewing, breathing and movement are working in harmony, kids don't just function, they thrive. But today's world makes that harder than ever. Preventable health issues are rising and our children are at the centre of it all. From feeding difficulties and speech delays to ADHD, anxiety and sleep disturbances, these challenges are no longer rare. They're common. But that doesn't mean they're normal.
There is no genetics for crooked teeth. It's only in recent centuries that things have started to fall apart.
The reality is modern life has pulled us out of alignment with how our bodies are built to grow. We've softened food, we've shortened sleep, replaced movement with screens, and disconnected from optimal health care.
The jaws don't get opportunity for catch-up growth. All those bones are smaller, not just the legs and arms. But because of baby foods, and there's a book everybody should read, it's called Inventing Baby Food. It was originally designed in the late 1800s for invalids. That's what they used to advertise it for non-growing people that couldn't chew, and infants. They shouldn't be chewing. That was the hypothesis. If it's soft food, it's a very poor functional matrix, a really rich functional matrix, and what we're adapted to and what we're hardwired for is firm, fibrous, fresh food.
But this is not about blame. It's not the fault of parents or practitioners. It's the result of systems that have forgotten how health actually develops.
My daughter Alice, actually one of my dear friends, Lauren Ballinger, who's also a pediatric dentist, pointed out to me that she noticed some things with my daughter on a picture on Instagram. So I posted a picture of her on her birthday and she commented, we actually spoke on the phone, and she said, Gloria, your daughter's so cute, but can I share some things that I've learned about that I can see already in Alice that I wish I would have done with my daughter Libby when she was Alice's age? And so of course I said, yeah, what do you see? She's like, well, does she breathe with her lips apart at night? Is she mouth breathing? And I was actually super offended. And I said, and we're dear friends from residency. We went to our pediatric residency together, so we're best of friends. So she could, ask me these types of questions candidly. And I went and checked on her. She said, fine, go take a picture of her and send it to me. So I went and took a picture of Alice, and she was sleeping with her lips apart. Not just apart, her mouth was open maybe half an inch. And I could see her little teeth as her head was on her pillow. And I reported back to Lauren that, yes, she's mouth breathing. What do I need to do? We immediately flew off, 2 weeks later, flew to Massachusetts. Like I said, I live in Dallas because there was no one really treating children in this capacity in Dallas yet. And she did an evaluation, and we just started clearing the nose at nighttime because she also had a pacifier when she was younger. And I thought I was really good at stopping it at 11 months of age, but really I've learned the best time to try to stop is at 6 months of age and switch to chew toys or chew appliances. And I didn't know that.
At Myo Munchee, we're here to change that by returning to what's natural, what's simple, and what's backed by science. We exist to help children everywhere grow into the healthiest version of themselves, one chew at a time. As practitioners and parents, we're seeing more children struggle, not with rare conditions, but with everyday signs that something isn't tracking quite right. Maybe it starts with constant drooling that lingers beyond infancy, or a toddler who only eats soft, processed foods. Maybe it's a child with a narrow jaw, noisy breathing at night, or difficulty sitting still and focusing. These are the early signals. They don't always look dramatic, but over time they add up. And in many cases, they're dismissed as quirks or assumed to just be part of growing up. But what if they're not? What if they're early markers of deeper imbalances, signs that the foundations for healthy development haven't been laid? From a structural standpoint, we're now seeing that many of today's common challenges, crowded teeth, poor sleep, speech delays, restless behaviour, stem from missed opportunities in those early critical years.
Things I look for is when a child walks into my office or sits in the chair, I'm looking at their posture, I'm looking at their resting posture of their mouth. Is their mouth open? Is their head forward? Do they have dry lips? Do they have cracks in the corners of their lips? And then when you look within the mouth, are they hydrated? What is their salivary content looking like? Something we don't think about, but saliva is this golden elixir of our bodies, and we have to be hydrated. Saliva protects our teeth. It helps with digestion, helps with swallowing, helps with speech. And then looking at the teeth themselves, do they look mineralized? Do they look strong? Or do they look impacted either with demineralization or decay? And these are signs of nutritional deficiencies in the body.
I've worked with babies who, were biting mom's nipple, and, they were clenching and having trouble. And of course, right now, a lot of people are rushing to do tongue ties. And amazing dentists who get the bigger picture will send them to me as a physical therapist and say, hey, look at that. This one baby was tachypnic, which meant they were breathing way too fast. They were in respiratory distress. And we were able to create huge changes by working on the whole body and get breathing changed. And actually their lips sealed, their tongue came down with no surgery and no major interventions. So working on that whole body picture when you address the why is huge.
You don't want these children to be mouth breathers because they're not sleeping well at night. Then they end up getting on ADD and ADHD medications. I mean, half of the children that we see in our pediatric practices are on attention deficit disorder medications because I think it's because they're not sleeping well at night, but they're not doing well in school. And that's where a lot of teachers are telling the parents, hey, there's something going on here. You need to go get checked out for ADD, ADHD. But something I think we need to switch around even from an early age is, hey, you need to get checked out. Is your child sleeping well? Are they sleeping with their lips together? Are they breathing through their nose? Or even if they notice that could change so much going into childhood, teenagers, adult years.
If a child hasn't had the chance to chew real, textured foods, and the tongue hasn't helped shape the palate early on, the midface doesn't develop to full potential. The airway narrows, the effects don't stay local. They echo through the child's ability to rest, self-regulate and thrive. And when we look at sleep, the signs are often hiding in plain sight. A child who snores, grinds their teeth, wets the bed, or moves constantly during sleep isn't just a restless sleeper. They're showing signs of interrupted brain recovery, night after night.
Kids should be dry, quiet, and still. Kids should be dry. They shouldn't sweat. They shouldn't pee their bed after potty training. They shouldn't drool. They shouldn't be having to get up to go to the bathroom. They shouldn't want water in the night. So that's the dry part. Quiet. You shouldn't hear them breathe. You shouldn't hear them snore. You shouldn't hear them grind their teeth. You shouldn't hear them bang their head on the pillow. And still, again, they shouldn't move around a lot in their sleep and head bang and walk in their sleep. So dry, quiet, and still. That's what we're looking for.
These children aren't broken, but they are growing up in a world that doesn't align with how their bodies are designed to function.
We don't find appreciable malocclusion in the fossil record at all at any age, because if you survive childhood and live to be an adult and pass on your genes and become an ancestor, you were chewing hard food. You were breathing clean outdoor air. You were forward, you were wide, you were horizontal. That is something that was vital to not only surviving childhood, but thriving long enough to get your genes into the next generation.
Most of this is invisible until you know what to look for. But once you do, you can't unsee it. And you start to realize these patterns are not random, they're systemic.
What we tell parents is the shape of the jaw can be something that can predict that there's going to be risk for it, or there might already be symptoms, and it's related to inability of the child to be able to put the tongue up into the roof of the mouth. And there could be restrictions from things like tongue tie. It could be that the jaw is just too narrow or too far back, too retrusive. They can develop a long face called adenoid face because they can't breathe through their nose. If they have a history of eczema, almost all those kids, regardless of the skin lesions, have respiratory issues that end up in habitual mouth breathing, and it messes up the dental facial development. So those are things that we see correlating with each other.
Crooked teeth, in fact, are just a sign that there's some other kind of imbalance in the body that frankly has led to a whole host of chronic, non-communicable diseases of civilization, of Western lifestyle, that are plaguing us in such a way that they're becoming an existential threat. The crooked teeth are a sign that that's going on, and yet as an orthodontist, I was paying attention to none of it. Now that I understand that the correction of teeth has to deal with the root causes, the proximal cause is soft tissue dysfunction. That is the way we hold our tongue at rest, how we use it for all the functions of the mouth. How we breathe is really, really critically important.
The challenges we're seeing in children today didn't appear out of nowhere. This isn't a sudden crisis. It's the long tail of changes that began generations ago. Changes in how we live, eat, and raise our children. Most people grew up in an unprecedentedly sedentary culture, and now a tremendous amount of what we had left has disappeared. Total human movement is undergoing an exponential decline. If we represent the whole of human history with a single 24-hour day, it took only 1 hour for anatomically modern humans to transition from hunting and gathering to farming, and a single minute to shift from farming to the Industrial Revolution and Information Age. Anthropologists have traced this shift back to a major turning point, the rise of agriculture and later industrialisation. As humans began processing food more heavily, grinding, refining, softening, we stopped using our jaws the way they were designed to be used. And over time, that lack of physical demand changed our biology. The bones of the face no longer needed to grow wide and strong to accommodate hard chewing. Jaws became narrower, palates became higher, the airway became more crowded, and slowly but surely, oral dysfunction became more common.
The functional matrix of the masticatory system is hard food, chewing it. There's no really functional matrix for long bones. These bones get longer if you feed a child well, and if they sleep well, and they get outdoors, and they get some exercise, they're going to reach their genetic height potential that they got from their parents. That's not so. Anything above the neck. it has to be grown. The cranial vault, our skull, the brain is the functional matrix of the cranial vault. The skull, the cranial volume will only reach its potential by expanding those soft spots, those sutures on the head. If the brain is growing, it grows it. Well, what grows the eye socket? The eyeball. The growing and moving eyeball will expand all those little bones that are connected in there that aren't fully developed. The nasal-respiratory complex. It doesn't grow. It won't expand. The sinuses, everything won't expand unless there's frequently nasally inspired air habitually while you're awake and asleep. That's the functional matrix. So what's the functional matrix now of the mouth? We said food. Food and what? The tongue and the lips. That is all in part of a matrix complex, if you will.
Dr. Kevin Boyd has spent over a decade studying pre-industrial skulls. What he found was striking. Even in children as young as 2 or 3, the craniofacial structures from 200 years ago were fundamentally different. Wider, stronger, more functional, because those children were using their mouths in a very different way. And yet, our clinical norms today are still based on mid-20th century data from children raised on soft foods and processed diets. We've accepted dysfunction as a baseline, not realising that it's a deviation from what human development could be.
Through a series of events, I started to become aware that the teeth that I was straightening were actually attached to a human being. That's not something I was taught, Orthodontists show their prowess by comparing before and after models of teeth, showing how meticulously and obsessively they correct every rotation, put teeth in line, balance marginal ridges, give teeth a beautiful occlusal scheme and so forth, but never considering how well those teeth match with the rest of the body. Once I started to understand that there were causes for malocclusion, for crooked teeth, that really had nothing to do with the teeth, I started understanding a couple of major premises. Number one, that teeth do not know how to come in crooked. There is no genetics for crooked teeth. Humans for hundreds of thousands of years had straight teeth. It's only in recent centuries that things have started to fall apart.
Healthcare has become fragmented. Each symptom gets its own specialist. Sleep problems go one way, speech issues another. Tooth crowding to the orthodontist, behavioural challenges to a different lane entirely. But these aren't isolated problems, they're connected. And unless we begin to look at the whole child, structure, function and environment, we will keep chasing symptoms instead of changing outcomes.
It really became obvious that we couldn't help a child grow to its optimum potential for breathing unless we involved way more than just one part of healthcare. It couldn't be just the dentist. It couldn't be just the functional therapist. It couldn't be the SLPs. It had to be all of them.
This is where the shift begins, when we stop asking what's wrong with the teeth and start asking what's happening in the body and why.
Our faces, the human face, is not growing or developing the way it did hundreds of thousands of years ago, even a few hundred years ago. And that the change in the shape of the face is leading to breathing problems because our airway spaces are changing as well.
What do we need to do to get the best results? So absolutely, you have to determine the why, because you won't get any long-term results. And I feel like airway and breathing are a key piece. So it's why were people not sleeping? And people said they were stressed and whatever. It's like, no, they're not breathing and sleeping well. So that's huge. That's life-changing. You can go a whole lifetime without a tongue tie, I say, but only minutes without air.
The solution lies in connection, not just within the child's physiology, but within our systems of care. Collaboration is no longer optional, it's essential. So where do we go from here? We've seen the rise in symptoms, we've traced the history. We know that fragmented healthcare is not working. The next step is to start asking better questions, finding out why the issues are there rather than treating the symptoms.
The problem is not knowing that there's a problem, and that is that children aren't thriving to their maximum ability because they're not eating unprocessed food. They're minimally processed food that's firm, fresh, and fibrous. They're not doing that, and people don't see it as a problem. They think it's, well, they're getting the nutrients, they're fine, but they're not. Well, there needs to be universal curiosity about this.
What if chewing was more than just a mechanical process? What if it was the key to activating the systems that support breathing, brain development, and postural stability?
The American Dental Association is behind this pediatric airway hygiene problem and how it needs to get into the dental curriculum, pre-doctoral and post-grad in orthodontics and pediatric dentistry. Well, there's a group of us and there's a lot of interest. It's slowly, not growing rapidly, but people are becoming very interested in it.
What if, instead of treating children as a sum of disconnected problems, we saw them as integrated systems, growing within environments that either support or suppress their potential? And what if we connected the dots around chewing, breathing, sleeping, and health? And what if we found a simpler, more collaborative way, bringing kids, adults, and clinicians together to engage and collaborate around health? That is what we call the Munchee movement.
We decided to collaborate. And that's how actually the very first study on lingual palatal suction came about. So it's after those 10 years of trying to figure that out, and then it took 2 years of working with researchers in 5 countries. So pretty exciting to see, and to see that everyone embraces that, but it was just an idea that, you know, paying attention to how that whole head, neck, and jaw was important, that lingual stabilization and that suction was essential.
A mentor of mine in dentistry said, "Man, this is exciting. We can do things to help people breathe better at nighttime." I said, "What does that mean?" And he led me through the learning about how dentists can get involved with breathing problems at nighttime by making mandibular advancement devices. So that's where we learned. And as a dentist doing other things with jaw joints and teeth and mouth and things, it was pretty simple to do a mandibular advancement device. Okay, so I go along doing that for a long time. I'm loving it because people come back and say, "I feel so much better. I'm so healthier. I think I'm contributing to overall health that way."
Working on that whole body picture when you address the why is huge.
I've been excited. It's sort of a grassroots movement. I'm seeing more patients and parents advocating for this information and education so that we can avoid the top chronic disease in the world, which is avoidable, and it's cavities and gum disease. But we know it doesn't have to be this way. And we know ancestrally as humans, we weren't prone to things like cavities. Our airways were pretty optimized. And so when you get into that from an anthropological standpoint, what changed, and a lot of it is our food change, how we're chewing or lack thereof, and our nutritional status as well.
Many of the problems that will lead to crooked teeth actually start off very early in life, if not before birth. I joke that someday we will be practicing intrauterine orthodontics. And really, if we can help the mother be healthier, breathe better, sleep better, have better nutrition, and better health herself, that certainly gives the baby a head start.
So it's a red flag if your baby's not tolerating tummy time. You know, if things are not functioning correctly, so much of growth and development is in those first 5 years. And that's why I've gone from treating mostly adults to primarily treating kiddos and trying to do, I mostly treat 0 to 3. So one of my passions is to try to develop a program to get into there so that we can intervene in the earliest stages, to be able to intervene so as early as possible, because we can make the biggest difference on their growth and development and their neurologic futures.
I really like parents to start thinking about taking or reducing the pacifier around 6 to 8 months old. And then certainly trying to have it gone by 1, because around the age of 1, that's when emotional attachment really starts to peak up. And that is between the age of 1 and 2 is where we do start seeing more skeletal issues and musculoskeletal issues, kind of functional issues sprouting up too. And again, it's the same concept the earlier we intervene, the easier it is to kind of unpack. But when your child is, 2, 3, 4, and they're still on a pacifier, we do see quite a few orthodontic issues that way, and they can be challenging to correct. There are, of course, ways to do it, but I just also think it's really important for your children to learn to cope and fall asleep and manage and get those inputs in different ways than through a tool like a pacifier.
And it's not just a concept, it's a growing global community, a shift toward prevention, toward connection, toward collaboration across disciplines. We bring together paediatricians and chiropractors, dentists and speech pathologists, parents and educators, people who all care about children, but haven't always spoken the same language.
A whole world of functional things opened up for me. Treating adults, it's always about structure. I move the lower jaw forward, I open the airway. Thinking about orthodontics or functional appliances or some other things like this, it was about structure. How do we get the kids' jaws to grow correctly and support the airway? And then myofunctional therapy and speech and language pathology, and how do we start the right habits going on? And that's when collaboration came in, because it really became obvious that we couldn't help a child grow to its optimum potential for breathing unless we involved way more than just one part of healthcare. It couldn't be just the dentist.
There needs to be universal curiosity about this. I've never been so fulfilled as a pediatric dentist than in the last 10 years of doing this. And it's all about collaboration. But, it's ultimately self-serving. I feel so good and rewarded when I'm at meetings like this and talking to people like you, sharing with physicians and myofunctional therapists and other healthcare professionals. People have to understand the rewards that can come from just collaborating and helping each other, doing this and understanding this and the impact that it has on little kids.
The Munchee becomes a bridge, a simple tool with daily practice of chewing that connects oral function to overall health and well-being. A tool that parents can use at home and clinicians can integrate in practice and therapy programs. We know chewing activates cranial nerve function. We know it influences jaw strength, tongue posture, and breathing mechanics. And we know that children who breathe well, chew well, and move well learn better, sleep deeper, and grow with more ease. This isn't theoretical. It's happening in clinics and homes around the world. We are seeing a chewing revolution occurring, one chew at a time. If we want a different outcome for our children, we need to start upstream. We need to recognise the signs of dysfunction rather than treating the symptoms as they appear. Knowing what ideal looks like and working with how the body was designed to function.
If you're starting to see neurosensory issues or airway issues, to talk about those early. So is your baby snoring? Do they breathe loudly? Do they spit up a lot? Do they have an open mouth posture? Then potentially there's a myofunctional imbalance. Looking at your child and seeing if they're mouth breathers, if they're snoring, loud breathers, a lot of reflux, sleep disturbances, that's an important thing to address early on. And it's important to know it takes a collaborative approach. So your pediatric dentist or pediatrician may diagnose this or have concerns, but then who do you see? And it takes a team. So you may be in these very young years seeing a chiropractor or a craniosacral therapist or occupational therapist, potentially a myofunctional therapist, to help finalize the diagnosis and to help treat and address your child early on. Because, again, we want to intervene as soon as possible and take kind of more of that preventative approach.
My concentration therapeutically has been to work with children that are younger and younger and younger. One of the things that I appreciate about the Myo Munchee approach is that it gives me a way to address these issues very early on in life. Of course, the orthodontist has less to do early on from a mechanical point of view, but if we can help a child grow up to have a good oral function and soft tissue function and good breathing, and better facial growth, then the teeth can come in much, straighter. My new goal is to put myself out of business. Of course, that won't happen, realistically, because many kids just don't get to me early enough. And so the work that you're doing in helping bring this issue to the fore in mothers' eyes and parents' eyes and the public eyes, I think is really critical, because the more we understand about it, the less we will allow children to suffer the dysfunction and the dystrophy of poor facial growth as we go along.
The truth is, human development has always depended on a few key inputs: movement, breath, nourishment, sleep, connection, and yes, chewing. These are the foundations of structural and neurological growth, and when they're present early, they do more than prevent problems. They build capacity, they build adaptability, they build health from the inside out.
I like to look at the first 1,000 days, which is the first 3 years of life, because that is where we know the oral and gut microbiome is mostly established. Those first 3 years are really paramount and important. But that first year, once you come out of your fog of having a baby, so being with your baby, resting and repairing, I think a lot of moms don't get that much time to really take care of themselves. So I think that's the most important part in bonding. So rather than throwing all these to-dos on someone. But I think breastfeeding is absolutely critical for airway development if you can and if that resonates with you. But we do know children who are breastfed, they do have more optimal facial and airway development. Breastfeeding, actually the act of elevating the tongue and lateralizing the tongue, it helps shape the palate, it helps shape the midface, and they're also getting such wonderful immunological benefits and the bonding, the connection, the neurosensory integration, and everything's really important.
My daughter came back once she learned about the importance of nasal breathing and lips together. In pre-K, she was only 4.5 years old. She said, "Mommy, do you know how many people in my class are mouth breathing?" And I said, "Alice, how many?" She said, 12. And there were 13 people in her class. So everybody, she started recognizing it too, that my peers, why are they doing this? And so it was one of those things, you want to share and spread the word with everybody too, but I had to tell Alice, I don't want you to start, pointing out people and picking them out saying, you're a mouth breather. Whenever she would go to sleep or whenever she'd spit out her pacifier, she learned that open mouth posture, the low resting tongue posture, and it just took some training. So really I had her start on a little appliance that she could wear at nighttime and clearing her nose before she was even 4 years old. When they're 6 months, if they're using a pacifier, please stop the pacifier and switch to something that they can chew on. Make sure the cups that we're drinking out of, they're open cups or a non-valve straw. I mean, these are all things I didn't know about when my babies were babies. Pouches, try to avoid pouches. Baby-led weaning is the way to go, because so many kids nowadays are just sucking their food. I made these mistakes with my first kid, and kind of with my second one. I started learning a little bit more with my Alice, but with my first, I gave him pouches, because the first time I gave him food, he started choking, or I thought he was choking, but it was just his brain saying, no, you need to chew the food a little bit more, and this is what I've learned. And so that way, I didn't give him that chance. So right away, I thought, oh my gosh, my son's gonna die. Now he can only have purees. So I chose that, but I didn't go to a feeding specialist, and I'm a pediatric dentist. This isn't something that they taught us in our residency. I went to share it with the world, let's do something now. We can do something about it.
But these inputs are not always readily available anymore. In today's world, they need to be restored intentionally through everyday habits, aligned environments, and informed guidance. It's why baby-led feeding matters, why nasal breathing matters, why crawling, climbing, mouthing, and chewing matter. Not because they're milestones to tick off, but because they shape the architecture of the body and the brain.
If you have healthy function, it will drive alignment, it will drive everything else. If you don't get function, so if I go in and stretch it and haven't addressed the why and the underlying functions, you're not going to get long-term results. We're looking at airway, and breathing. I check their vitals. check their respiratory rate, check their heart rate. Some babies, I even have to do special testing, CO2 capnometry, to see what's happening. So I think that is really key. And we look at breathing from the whole body. Everyone thinks of breathing as the nose, but it's a whole body pressure system. The whole body's involved.
I mean, from the cross bites to the deep bites to the anterior cross bites, I mean, all of these, the open bites, you can tell so much and you can kind of see what's going on before even asking the parent now. I mean, I can see that from a mile away. The kids with the cross bites, like they're only chewing on one side and you can see their condyles, you can see things forming, like everything's becoming so asymmetrical, and just getting things back on the right track can change, I mean, the way their face develops. I was one of these moms, and as a specialist in my profession, I had no idea how things can be, like you can have this intervention so early in life when things are off, because it's much easier. I mean, yes, you can take care of things later on in life, but it's so much more involved and it takes so much more time. And you think, oh, I don't want to spend the time or the finances right now to do that. It's actually so much worth it, because if you look at what you can do at the beginning, it's so tiny compared to what you have to do later on in life. Or then have these children suffer, and they're suffering at school and not doing well, they're tired, their grades aren't doing well, and then as teenagers they have anxiety. How about we as parents give our kids the best that we can from when they're babies? There's so many little things, and that's just something that we always share with patients in our practice, that you can do when they're young, just to have a lifetime of good health.
Yeah, my personal experience with the Munchee has been overwhelmingly positive, and I can see the positive impacts had on my life, and that's then informed how I want to go about raising our kids. Not dogmatic about it in the sense that we probably get a munch in their mouths 4 or 5 nights a week for a minute or two. Health is such a critical part to having an enjoyable life. If you don't have it, you want it. And that's what we're trying to give to our kids, the best opportunity to have a healthy body that's going to serve them well for their whole life. That's the opportunity my parents gave me.
If things are not functioning correctly, so much of growth and development is in those first 5 years.
We have been hyper-focused on brushing and flossing and avoiding sugar and focusing mostly just on cavities and maybe gum disease, but we're missing a lot with growth and development, facial development, and how that impacts the whole child, their neurosensory integration, their behavior, their hormones, how these things affect their oral microbiome, their gut microbiome. I mean, the list goes on and on.
The way forward is simple, but not passive. It asks us to pay attention, to get curious, to intervene earlier, and to intervene wisely. At Myo Munchee, we're not just offering a device, we're offering a new way to think about health. One that trusts the body's design and supports it with the right inputs at the right time. It starts in infancy, it strengthens through childhood, it stabilises into adulthood. And it all begins with one small action: chewing.